Anytime you experience swelling in a joint, it's probably a good reason why you should go see the orthopedic surgeon. If you've had an injury, you feel a pop, you've had a twisting movement, something gives way in your knee, those are good times to see the orthopedic surgeon. When you can't bear weight on your leg, particularly if you can't bear weight on your leg without limping, or you can't use your arm or your shoulder or your hand without pain, those are times when you need to go see the orthopedic surgeon. Remember, the first aid for any orthopedic injury: rest, ice, compression, elevation. It's the mnemonic RICE, R-I-C-E, rest. Put your arm in a sling if necessary. Use crutches to protect your leg or your foot if required. Use ice. Put the ice in a plastic bag, put it on the injured joint, leave it there for about 10 minutes or so. Compression. Sometimes this is a supportive wrap like an ACE bandage, but make sure it's not too tight, because if it's too tight, you'll get swelling beyond it. And then elevation, which is extremely important. Get the injured extremity elevated above the level of your heart. That's very important first aid. Usually if that pain and swelling continues for a day or so, it's time to go see the orthopedic surgeon. If there's obvious deformity of your arm or your wrist or your ankle, you need to go to the hospital emergency room or call the orthopedic surgeon. If you can't walk, you need to call the ambulance. Don't try to walk if you've fallen onto the floor and you cannot get up. That's an important time to call the ambulance, because you could do further damage to yourself by trying to walk with a broken hip. It might turn something that's a fairly simple fracture and easy to fix into something that requires an involved surgical procedure to improve it.